Energy costs are driving inflation and changing our energy choices.
Marketplace Morning Report is supported by GEP, working to help companies optimize value and reduce risk with the AI-native GEP Quantum Intelligence Procurement and Supply Chain Platform.
From Marketplace, I'm Kimberly Adams. We get a new batch of data later this morning that will give us some insight into how quickly prices for a variety of goods are rising. Economists expect the May Consumer Price Index will reveal prices have gone up for the third month in a row, likely hitting 4.2% in the year-over-year measure. One thing in particular analysts will be looking for in today's data, how much the rising energy costs due to the war in the Middle East are rippling through the rest of the economy. And speaking of energy, oil prices spiked overnight after the U.S. launched military strikes on Iran in retaliation for the downing of an American helicopter near the Strait of Hormuz. As prices fluctuate, solar power use in the U.S. is hitting new milestones. Marketplace's Nancy Marshall-Genzer has more on that.
Solar is the leading source of the new power being added to the U.S. electricity grid, according to the Solar Energy Industries Association. In a new report out today, the association says solar and energy storage accounted for about 90% of new grid capacity in the first 3 months of this year. An Associated Press analysis says that in May, for the first time, the U.S. got more of its power from solar than from coal, with 12.8% coming from solar and 12.2% from coal. That's despite President Trump's efforts to boost coal. The Solar Energy Industries Association says 74% of all solar capacity installed in the U.S. in the first quarter of this year was in states won by President Trump in 2024. I'm Nancy Marshall-Genzer for Marketplace.
Let's do the numbers. The FTSE in London is down 0.4%. The Dow, S&P, and Nasdaq futures are down in the 0.6 to 1% range, with the Dow future down just over 0.6%. Now then, our free daily wrap is newsletter brings all the day's news and numbers straight to your inbox every weekday evening. It'll take you less than 5 minutes to catch up, read the latest issue, and sign up for the Marketplace Daily Wrap at marketplace.org/subscribe.
Marketplace Morning Report is supported by Schwab. At Schwab, investors get choices ranging from self-directed investing to full-service wealth management all in one place. Learn more at schwab.com. And by Bitwarden, designed to strengthen online security for businesses with a password manager built to secure logins across all accounts and devices. Bitwarden.com.
We started our series on rural healthcare this week with a visit to a shuttered hospital in Thomasville, Alabama, a community of about 3,500 people an hour and a half north of Mobile. We've been looking into how policy choices at the federal level can affect healthcare choices available at the community level. But as we were talking to folks, there was one issue in particular that kept coming up.
Is our low reimbursement.
They are extraordinarily low.
Our reimbursement rate for insurance is a lot less.
They can get a job there and make so much more money because they have such a better reimbursement rate.
In Alabama, we got the lowest reimbursement rate in the nation. The lowest in the nation.
That last voice was Sheldon Day, mayor of Thomasville.
If you look at the demographics of Brunswick, Georgia, and you look at the demographics of Thomasville, very, very similar. Isolated rural areas. Brunswick, Georgia gets 90 cents on the dollar reimbursement. We get 65.
Why is that?
I'm glad you asked that question because that's the question I keep asking. Why is the formula slanted that badly? 30 years ago, pretty much every hospital in our region was delivering babies. Now there are zero. Zero. And in my opinion, a lot of the costs have escalated because of the way we reimburse from a national level.
Hospital insurance reimbursement is very technical, and we're not going to get too deep into the details. But the simple version is that for older Americans on Medicare, the federal government decides how much it will pay for medical services based on essentially wages in a given area. Wages are pretty low in Alabama compared to elsewhere in the country, so the Medicare reimbursement rates are relatively low as well. Liz Walker is Executive Director for Telemedicine and Rural Initiatives at the University of South Alabama Health System in Mobile.
And it's almost like kind of the origin story of then how your commercial rates are set off your Medicare rates. So when you start with a low number, everything progresses from there.
Private insurance, Medicaid, the Children's Health Insurance Program, and the low reimbursement rates in Alabama shape how much doctors and nurses get paid and how much money hospitals and clinics can make. Walker says one reason it's so hard to fix this system is that it's effectively a zero-sum game.
It's a set amount of money that the federal government is going to put towards this number. If our wage index goes up, someone else's is going down.
We met Dr. Marsha Rollerson, a pediatrician of more than 40 years in Bruton, Alabama, an hour and a half from Mobile. Over a lunch of catfish, grits, and fried green tomatoes, she expressed similar frustrations about the low reimbursement rates.
It has to do with some formula that I don't understand at all, that has to do with the makeup of your state, but it doesn't make sense anymore.
So what are the solutions? There is money set aside for rural hospitals in the big tax and spending law President Trump signed last year, and Alabama is getting just over $200 million. But it's not going to boost the rates or even shore up the operating costs for rural hospitals.
I don't want to disparage it, but it's pie in the sky. Did anyone talk about how important it is that we get paid fairly from Medicare patients? Did anyone talk about the fact that so many people don't have insurance and don't come in until they're really, really sick? Is there anything in this document that's going to change that? Those are our problems.
Rollerson is talking there about Alabama's plan for that new Rural Health Transformation Program. States across the country are waiting on next steps from the federal government to get the money flowing. We'll have more on this and other potential solutions for the rural healthcare crisis in the rest of our reporting from Alabama this week. I'm Kimberly Adams with the Marketplace Morning Report from APM, American Public Media.
You can